What are the most common symptoms of thyroid disease or thyroid hormone issues? And why do doctors miss this so often? My name is Dr. Dave Morris. I'm the owner of Magnolia Medical Center here in Murfreesboro, Tennessee. Magnolia Medical is a root cause functional medicine clinic. We're the largest of its kind in the Middle Tennessee area. Between myself and the other providers in the office, we have over 60 years of experience in dealing with root cause medicine. And the subject is something that we're passionate about. We see patients on a daily basis, hundreds of patients every year regarding thyroid issues. And I think it's important to talk about what are the most common symptoms and why most doctors miss this. So one of the most common, probably the most common symptom of thyroid issues is just fatigue. And I don't mean just fatigue like, oh, it's just a little bit of tiredness. I mean fatigue. You're tired all the time. You sleep 12 hours and you wake up and you still feel tired. You just can't get enough sleep. Your favorite place is the couch or the bed. That's number one symptom. Then other symptoms are things like your hair falling out or your hair thinning. That's a big one. Your nails being brittle, your skin getting thinner. These are very common symptoms of thyroid issues. Intolerance to cold, right? You feel cold all the time. That's a very common symptom for hypothyroidism. The skin being itchy or dry. High cholesterol is a common thyroid issue. Before we go in, let's not try to cover every possible symptom. And the reason I'm going to say that is because every single cell in your body requires thyroid hormone to activate certain cellular processes. It's required. Every cell in your body has receptor sites for thyroid hormone, which means any symptom you could possibly have, the brain fog, even something that you wouldn't think would be related to thyroid, like toenail fungus, could be related to or even caused by a thyroid hormone disruption. So anything in your body could be due to thyroid hormone. There's just the most common things. Again, that brain fog, that tired all the time, your hair and nails, digestive issues, high cholesterol. These are very common ones. Why do doctors miss these things all the time? I think if you've ever followed me on other social media, you would know that I have a real problem with how most modern medicine, most doctors, most providers gaslight patients, especially women. You are told that it's all in your head. So this is a big reason why it's missed. I'm just letting you know, it's a big reason why it's missed, is you're told it's all in your head, you're getting older, this is a part of life, suck it up. Everybody experiences these things. They tell you, just lose weight, diet, eat better. They tell you all these things without actually taking the time to dig into the underlying problem. Another major reason, and this is something that in our office I am personally very passionate about, is lab work misinterpretation, okay? Doctors look at lab work, they look at it on a very cursory level, and the lab values are completely inaccurate, okay? They're just ridiculously inaccurate because they're too broad. They're based on the entire population. You're graded on a curve, and the sicker our population gets, the more normal looks. And that's just the wrong way of looking at things. These are the two biggest things that I've seen personally in my 28 years of practice and the research that I've done and the thousands of patients that I've seen and talked to. These are the two biggest reasons why thyroid issues are not looked at, they're not addressed, is, again, you're being gaslit by the providers and the misrepresentation or misinterpretation of the lab values. There are some other things that contribute to somebody being misdiagnosed. Is only looking at TSH. If you're only looking at TSH, thyroid stimulating hormone, and trying to make a diagnosis about thyroid problem being related to TSH only, you're missing a huge part of the picture. I mean, probably 95% of the picture is missed just by addressing TSH. And again, we can go back to the lab values on that also. TSH lab values from the usual CLIA certified laboratory is they're going to be too broad to diagnose a thyroid problem. Most doctors are not looking for Hashimoto's. It's another example of where doctors are not addressing things properly. 95% of all hypothyroid conditions, according to research, is 90 to 95% of all hypothyroid conditions are due to Hashimoto's, and most doctors are not looking for that. And even when they are, again, as the population has become sicker and more people are getting autoimmune diseases, those ranges become broader, so less and less people are falling inside, less and less people are falling outside of what used to be a clinically significant range, and now they're considered normal. That's not good for diagnosing things. You're missing diagnoses by changing the lab values, and they've changed drastically over the years, especially thyroglobulin antibodies. That's where a certain type of white blood cell is attacking a protein in your thyroid gland. That range has broadened so much in the last 10 years that to determine whether somebody has Hashimoto's based on thyroglobulin antibodies is almost, unless they're really, really, really out of range, somebody wouldn't even be diagnosed, whereas you used to be able to use that as a very good indicator of Hashimoto's. So there are some of the great reasons why doctors miss this all the time. It's by far not the only ones. Another reason is doctors get to spend 6 to 8 minutes with you. The fastest way to get to their next patient is to write you a prescription. If they can't see something on the lab work that says why you might feel tired all the time, they just say it's in your head, and you're likely to end up with some sort of antidepressant or antipsychotic or something that just says you're crazy. And again, that sort of goes back to that gaslighting, although it might not be a verbal gaslighting, it's a written gaslighting with a prescription that says, I can't find anything wrong with you in your lab work, it must be in your head. Another way of gaslighting you, I have a real problem with most mind-altering medications. I believe that, well, we could say that for another day, but I think that industry is completely corrupt. And the psychotropic medication industry. That's a topic for another day. Here at Magnolia, we do believe that people are suffering. We 100% believe that people suffer. We talk to people every day that they're trying to get their life back. They're trying to live a better life. They're trying to spend time with their family, spend time with their kids, spend time with their spouses. They want to put more life back in their life, and they're not getting answers. I want you to know, whether it's us or some other place, there are answers to be found. You've got to look for somebody who really, truly understands root cause medicine, is willing to do the right testing, which unfortunately you might have to pay for because insurance companies don't really support root cause medicine. They're in bed with the insurance companies, the drug companies, and the hospital corporations. They're all in bed together, and you probably weren't invited to the party. Anyway, I hope you found this information helpful. If you did, there's ways of helping us out. You can hit the like button, hit the share button, and certainly follow us for more content that might be helpful to your health. Appreciate you watching.